Medical Dilemma.
Welcome back to Medical Dilemma. First of all, I'd like to say thank you to our major sponsors, St. Clair's Medical Center and LifeQuest Training and Consultancy Corporation. Now, for this segment, joining me are my co-host, Attorney Sara Suguitan, and Dr. Teresita Sanchez. Okay. We were talking about emergency cases earlier in terms of seasonality, and knowing that the holidays had just finished, I guess we can start from there. Okay? So you mentioned, Doc, cases of hypertension, heart attacks rising exponentially, I guess,
yes,
during the holidays.
That's correct, just because of the sheer number of people. Yes, but I mean, I think usually when around New Year time, no, people always think about the fireworks injuries,
yes.
no? So because they see it on TV, people's hands get blown off and all that, no. So I guess I'm happy to say that in the past years there's been a decline in the number of these cases. No? So I think maybe the government's awareness campaigns have been paying off. Maybe there's more quality fireworks production, so there's less accidental discharge. For whatever reason, we've seen a decline really over the past few years.
More regulation now.
Yes.
Like for example, where I come from in Balanga City, there's an ordinance. No, there's people are no longer allowed to buy and even set off fireworks during the New Year. Can you imagine? City ordinance. So I think this is duplicated in many cities around the country. That's why it also contributed to the decline ng fireworks-related injuries this New Year. But still, there are many pa rin that have had their fingers blown off or certain body parts, etc. So it's still very much. I mean, people still do it anyway because of tradition.
For the more affluent families, sometimes they resort already to fireworks, up in the sky. That's why hindi na masyadong
not the exploding ones
nasusugatan, not the exploding ones, like what you call it, piccolo ba?
Wadusi,
I
bawang,
think
yan.
that's the riskiest.
Every year there are new ones. Meron pang Goodbye Philippines,
Ayun nga,
Super
nag-goodbye tuloy yung
Lolo.
isang-
Oo nga.
Cinturon ni Judas, so they have different names.
Every year they have to develop new ones.
And they make it themselves at home. Sometimes
Yes,
they're
correct.
gunpowder and then glass. Talagang delicate, the drum. They
The
put
homemade ones,
everything in the drum and then they just let it explode. Yan yung mga talagang very prone to yun nga, injuries, and accidents.
Yes. One question that comes to my mind is, if let's say somebody gets injured, let's say a limb gets mangled because of a firecracker, when do you decide to cut it off or reconstruct that limb?
Yeah, well, I guess that one will be the decision of the surgeon. No? So there are, of course, many different levels of severity. So most of the ones we get are just skin deep, maybe, or a little deeper than that, and so the limb will survive. No? But sometimes the limb really gets damaged beyond repair. No? So those ones have to be amputated. Yes.
And there's no alternative.
Sometimes
to that.
there's no alternative, because if the injured limb, if you want to keep as much as possible, sometimes there's gangrene and they'll get infected, and it can extend and spread to the rest of the body, so the person's life will be in danger naman. No? That's why sometimes the option is to amputate, remove the mangled part to make sure that the infection doesn't spread.
I see. Now, in a related scenario, mga shootings, okay? So stray bullet cases. How do you know if a case is a case of stray bullet shooting or intentional shooting?
Yeah. Well, actually, I'm happy to say that even the case of stray bullet injuries have also been declining. No.
Yes.
Typically, you'll know it's a stray bullet injury because of the trajectory of the. I'm not a forensic expert, but a stray bullet will be coming straight down. Usually,
normally from up.
Kasi people fire up.
Right.
Diba? And so the bullet goes really high and comes back down, but still very fast. So sometimes they'll come in straight down through the top.
Who fired the shot.
Yeah, well, actually,
Dapat.
buti lang sana, but sometimes it's the innocent people who get hit. No, I grew up in a house near one of the army camps. No, so before growing up, in the morning we'd always find bullets in our garden.
Oh my gosh.
So because people fire, lalo na
Thanks
Armalite,
God you
automatic.
survive, huh?
Yeah, well, if you're indoors, siguro. But you find some bullets. So that's the common stray bullet. It's usually fired up in the air and then it comes down. So the trajectory of a stray bullet will usually be from the
yes,
top.
that they don't know, no? Sometimes they just
That's a
fire,
very
no?
good.
Yeah.
Indiscriminately.
Yes,
Oh, what
but
do you
that's
call
been
that?
going down also. Even the armed forces and police, I think, have been better at chasing down the people responsible for discharging their firearms,
Yes.
unauthorized discharge.
And in the practice in subdivisions, no, we check the firearms of the security guards.
Right.
They are really
They put a
placed
tape.
some tape, yeah,
Ah.
to
And you
ensure
count
that
the bullets.
if something
yeah.
happens, hindi sila ang
Yes,
guilty.
so it's also improving in that respect.
Now, if you get such cases in the emergency room, are you obliged by a law or something that you're supposed to report it to the police?
Yes, there is. So our security guards are informed, or they're aware of the procedures. They report it, they record, and then they're in close coordination with the local police.
You know that law, noong pa yan, doon time pa ni President Marcos, because they want to flush out all those insurgent people, no? So, but then now it was sort of amended so that you don't
Okay.
have to report to the police now, but you have to report to the nearest health authority. Pwede
Health
na yun,
authority.
pwede na. But of course, our practice is to report also so that they have
Yes.
statistics on crime.
Yes,
At least, nalalaman, di ba?
Also, by the way, the Department of Health, every holiday season, they have this central reporting of all fireworks injuries and firearm-related injuries. So all the hospitals have a central reporting system so that the DOH can get the statistics.
Okay.
Kaya si Secretary of Health Garin already, agad, no? They could, when she was interviewed, she has already the statistics
Yes,
there, no?
because there's a
Alam na
reporting
alam.
system in place for
Yes,
all
and
hospitals.
that's why she's suggesting that piccolo should really be banned because I think that's the
Maybe
riskiest.
the
Very common,
foremost.
very
dangerous
common,
now.
Yes, I see.
Parang ano ba yun? Was that like similar to what firecracker before?
Like yung
Yung
parang
piccolo,
triangulo, something like that. So there's
But
small
is it the
hand
same?
lit.
There's gunpowder.
Yes.
Yeah, there's gunpowder and then there's parang iba-iba yung term eh. Like in Bataan, I think ang tawag namin doon yung sinturon ni Judas, yung marami
Yes,
sila.
marami. Oh.
Ah,
Oo,
marami
yeah.
sila,
Is
and
that
then they
different from
just go
piccolo? Piccolo
anywhere.
makes a sound, I think, when it goes off, like a whistling sound. Maybe that's
So a lot
why
of them,
they
they
call
put
it.
them together, no? So that's a lot of these super lolo or whatever, and then they put it together. Yun yung mga sinturon, no?
Is that the one that travel also? Those are
There are
sometimes
some
they
that fly,
enter.
oo.
Oh my
They're
God!
connected,
You know,
like
I
a
have a
belt.
doctor friend, and the house was newly built, and it was Christmas. No? Talaga nasunog, ha?
Yeah.
Newly built house because nag-stray doon yung
There are
ano,
some parang helicopter when you
yung-
light it. Parang
Oo.
lumilipad, and then you can't
lumilipad.
control.
Ang gandang
So it can
tignan,
land
no? Pero
anywhere.
delikado.
Oo. Yes.
That's
Yeah.
another risk pala, no? Arson. I mean, setting your houses on fire, property on fire.
Sinasadya. Oh, naku, ang hirap kumita ng pera. Gagawin natin.
Hindi kasi, Doktora,
Yeah.
it's a tradition of Filipinos. We have this belief that for New Year, you need to create a lot of noise.
Yeah.
And then,
Coins,
light
no?
up.
Bad
Yeah, to drive
spirits.
away bad spirits.
Oo,
Yun.
and then
Oo.
put coins in your pockets
In your pocket,
and
etc.
everywhere.
So it will be
Make
very
a
hard
lot
to
of
drive out
noise.
that belief. What the government, I suggest, can do, aside from banning firecrackers altogether, is to, like abroad, they have lights show, di ba?
Yes,
Yung
yes.
talagang
Yung parang in
malakihang,
general na for the
for the
public.
public, so that
Oo.
people can go
Oo.
out and watch this.
Oo,
Yes.
yun
No?
na lang.
At saka
no?
matagal, wag naman yung parang 5 minutes lang.
Oo, tama.
Like
Diba?
in other countries, that's the practice, no? Usually the government will put on a very professional fireworks display. Everybody just goes out and watches, no? So
Saan nga ba yun? Sa Abu Dhabi? Saan ba yun?
In
Merong
Hong Kong,
sunog?
4th of July.
Yeah, like that, oh.
In
But then
Dubai.
there was a building, there was a hotel that got
Yan,
hit by
danger.
fire.
Oo nga.
But probably
Setting
not from
things
that.
on
Not from
fire.
the fireworks. Kasi those
Not
are
from that.
professionally done, no? So the safety is more.
I suppose the number of cases of drunk driving also rises
yes,
during
yes.
holidays.
Yes,
And
definitely.
consequently, the number of emergency cases connected to drunk driving also rises.
Yes, that's definitely true.
Yeah.
Yeah.
Kasi these drivers, they think that the alcohol will affect everybody except them.
Baliktad. When it
They
actually
don't
affects
drink.
the individual.
They
Yeah.
think
And
it
there's this
will not
attitude
do
also
harm.
na, holiday naman eh. So, you know, parang there's make an exception. So,
But this year, parang wala naman masyadong vehicular accidents,
as
right?
much, yes.
That is drunk related.
yeah, so I think there's really a rise in awareness, no? I think, which is a good thing. People are more aware of the dangers, and so they're refraining. Meron pa rin actually, but you know, there are less.
And di ba, Sarah, there's a new law that we have on drunk driving.
Oh, yes. Republic Act 10586, which was enacted 2 years ago. And, you know, it was met with a lot of well, resistance also by the tour operators, bus companies, etc. Because it punishes, aside from the driver, the operator of so there's a fine, there's etc. So well, drunk driving is really prohibited. It's a traffic offense. So yeah, so in
That's
general,
right.
even before this law was passed, what this law has attained is it has increased the penalty, the
Malaki nga,
fine.
prohibitive.
Yes, may mahal. From
Oo.
20,000 to
Even 80,000 pa.
80,000
Yeah,
meron.
22 to
May
80.
graduation of penalties. And then, aside from that, yung probable cause. So, if you're swerving or if the law enforcement officer sees a car that's driving recklessly, aside from the traffic offense, they can test you for alcohol or for drugs, no, to find out if you're well, you can be held liable for the traffic offense plus the drunk driving, or if you're driving under the influence of any drugs or other substances. So that's what the law aims to prohibit.
It's supposed to be effective already, right? But it
Yes,
seems
yes.
that no one has been already caught yet under that. What is the reason kaya? Is it lack
Yeah.
of what? Facilities, manpower, or what?
Yeah, it's possible that there's also a lack of. It's also difficult to enforce because aside from the telltale signs of drunk driving or driving under the influence of other substances, of prohibited substances, the officer has to conduct a test. And sometimes they're not equipped with the proper testing equipment.
Oh,
So,
like the breathalyzer,
yes,
no?
the
That one to
breathalyzer,
test the
etc.
alcohol level of
Yes,
the
to
blood,
test the alcohol
no?
level. And then also, kasi pag naman driving under the influence of drugs, they have to ask the driver to step down and then bring them to the nearest police station for drug testing. So, minsan, din yan, may constriction din kasi the police station will be busy with other crimes, cases, etc. So they're not preoccupied with just that, walang special task force or anything. And the deputization is also parang it's deputized to police and then also the MMDA and then all the local government units na may permanent positions. Parang ang daming deputized, but at the same time they're also busy running after the other criminals.
Yes, and
So,
probably lack of training yet. Parang wala akong nabalitaan
true.
pa na they were already trained for this, no?
Yes,
It's
because how
a-
do you
a medical
apprehend?
procedure, actually. Yeah.
Yes, that's true. Apprehending is easy. You just tell them, please step off your car,
Okay.
etc. Pero after that, how do you analyze? I mean, kasi nakalagay doon, if you smell the breath of the driver, minsan, what if
Wala
it's just
naman.
bad
Bago.
body odor? May amoy, di ba sasabi, amoy
It's
chiko?
very bad.
No, sinasabi kasi amoy chiko. Paano kung if it's not? And then the test has to yield may 0.05% blood alcohol concentration.
content,
As you said,
yes.
it's a medical training that has to be
Right.
given to our law
Yes,
enforcement
yes.
officers. So, and the law is relatively young, 2 years. So, baka kaka-implement pa lang ng rules.
Yeah, it might take time before it will catch
Although I think
on.
it's a good initiative that it's already there. People know that the laws. So
They should be aware. Dapat hindi na,
Hopefully,
no?
yeah.
They should avoid being in that situation because it can be taken advantage of. There might be abuse in the diagnosis of these people.
Yeah, alam mo, Doctor, kasi when it comes to alcohol, not everyone can handle alcohol properly. I mean, I'm not justifying people who drink.
Especially first-timers.
Especially
Ah,
first-timers.
they can't
Minsan
handle
meron
it,
talagang
yeah.
pag nakainom sila, konti lang. They do embarrassing things.
Yeah, already.
So, not everyone can handle alcohol properly. Mas delikado yan, of course, when they drive because people don't realize that driving a car also means that the car can be a killing machine. I mean,
Yeah,
you can
right.
hit other people with it, you can cause injuries to others. You can be well protected in your driver's seat, but what about the others na you might cause harm to while you're
Yeah.
driving under the influence of drugs or alcohol?
Pero yun, especially now, nag-uuso na sa mga Pilipino to drink. No, before
Yes.
we just take light drinks, Coca-Cola, whatever. Now, talagang there's sometimes a toast, no? So
Yes,
may
yes.
wine, may something like that.
Well, affluence also brings that. Well, as society becomes more affluent, we were introduced to other luxuries, so to speak. And apparently, different kinds of alcohol is one of those luxuries that are introduced to an affluent social class. So
I'd like to share a story about drunk driving, a personal story. There was one time I was exiting a side street and going into a main street, okay? And it turns out that while I was making that left turn, there was a motorcycle running quickly towards me.
But you're on the
And it-
right side.
I was on the right side.
Okay.
Then it hit my front. It hit the front of my car. Okay. And of course, the motorcycle rider, toppled over, and I had to rush the driver to the hospital.
Okay.
And it turns out the driver was drunk, like totally drunk. You could smell it from 1 kilometer away. And even the doctor said, lasing ito. And so the police came because it was an accident and there were injuries. So they investigated, and the conclusion was it was my fault. So in
why?
that
Why? Because you're
in that
the one-
scenario, is it really my fault? I mean,
Was it really your fault? What do you think?
I don't think so, because
What do you think?
I consider myself a very careful and a responsible driver.
Yeah, and a
I
drunk,
made
a
the
drunk
correct
driver.
signal. I went on the right side of the road, and then here comes the motorcycle.
Oh my God.
Actually,
Unfortunately, it hit the front of my car.
Yeah. Actually, that what you described happens very commonly. We see that a lot in the
Yes.
emergency room, no? I mean, unfortunately, a lot of times the driver of the car, it's the one who gets hit is the irresponsible one. I mean, a lot of times, not to generalize, but we see that a lot. Sometimes people running across the street, but well, in the society, it kind of happens that if you're of the car, ikaw yung may pera, and so you're expected to.
Exactly, that's
to
what
put
happened.
out,
I
no?
ended
So-
up paying for
Yes.
everything.
Hospitalization.
And even the insurance company told me, aminin mo na lang para bayaran na lang ng
Settle.
insurance.
Just settle.
Kasi you were not injured, right?
I was
were you
not injured.
Oh, kaya ganun.
Yeah,
Oh
so
my
actually that's very
God.
frustrating for us also in the ER, because a lot of times we'll get that case. Let's say a child ran across the street,
Yes.
3 years old sometimes, they're not being watched, ran across the street. Some
Okay.
poor guy is driving by and you can't avoid it. And then when you get to the ER, the mother of the child is screaming like you're a
Screaming,
murderer or
wailing,
something,
yes.
when in fact, you're driving very responsibly and they're the irresponsible ones. No?
Oo nga.
So, well, actually, in our we see that a lot, and unfortunately, it just so happens. Usually, the easiest way to do it is to shoulder first all the initial treatment,
Yes.
and then just say, okay, tinulungan na kita, so, dapat quits na tayo, something like that, no? So, because if we're to have to establish whose fault it was and all that, that would require the
Ay,
police
yeah.
report, the court case. This patient needs
That's urgent
treatment
care.
or-
yeah.
or-
Uy, pero Sarah, supposing there was this driver who was alcoholic with alcoholic breath, who do you think would win in court? I mean, will there be liability for an innocent
Yeah,
driver
supposing-
like
supposing
Sunny
nilaban
here?
ko.
Oh, yeah, in your case.
Yes, which
So,
I think I was in the right.
yes.
So it's supposing it went to court. I mean, the mere fact that there is alcoholic breath, do you think that will diminish or increase the liability of that person?
Well, now, if that incident
Because-
happened now, for example, the immediate penalty for the drunk motorcycle driver will be the confiscation and revocation of his driver's license.
Oh, mabigat na ngayon.
Oo,
Talagang that
mabigat yan.
involves
For
licenses
first
now.
offense, first time niya nahuli na drunk driving siya, although he was injured in the collision, his license will be suspended for 12 months. But if it happens again, permanent, he will no longer be allowed to drive, period. So for the second conviction.
Yes.
Now, in your case, the presumption is that you are the one at fault because he was the one injured. So,
Yes, that's right.
barring the finding
That's
of
exactly what the
alcoholic,
police told
yes,
me.
yun, yung
Right.
presumption kasi he was the one injured. So,
Yes.
so for purposes of hospitalization or first aid treatment, that has to be settled immediately bago magsimula yung treatment. I mean, practical, ganon. Pero legally, the liability, yun nga, if he didn't test positive for alcohol, it will be on your part to establish that you are innocent. So,
Correct.
kasi nga
That
may
I
injury.
understand.
Yes,
I
oo.
understand.
But because there was proof that he was drunk during that time, then automatic yung confiscation of driver's license plus he can be penalized kahit wala kang injury on your part, even on your car, no? He can be penalized
Yung
in terms of
drunk-
fine.
yung drunk driver.
motorcycle
Siya
driver.
hindi drunk?
Oh, siya
Hindi.
hindi.
So the
Dapat
license
hindi.
will not
Yes,
be,
oo. But this is
Okay.
after due
Removed.
process, Son. This is
Yes,
after a
yes.
court case.
Oo.
Okay, attorney, we'll have to
Conviction
take a
kasi.
break at this point. Let's continue with that point after a few words from our sponsors.
why when you share something to a public, you find that experience, and that experience so rich it could change other people. Okay?